Our goal is your satisfaction. Let us show you the way.
Can toothpaste help boils? This might seem weird, but if you feel the boil coming on, use Colgate Triple Action or Smart Foam toothpaste or Breath Strip toothpaste. Take a piece of gauze and squeeze it on there. And let it sit for 20 minutes and wash it off. Do it 2 or 3 times as often as you like it. It will take the pain away. Can Vicks help with boils? Patients also report that it can encourage painful abscesses to rupture and drain, providing relief. When Vicks is applied over a clean, dry lesion and covered with a Band-Aid, with or without the use of a heating pad, it can help shrink a painful bump. What can draw out a boil? The first thing you should do to help get rid of boils is apply a warm compress. Soak a washcloth in warm water and then press it gently against the boil for about 10 minutes. You can repeat this several times throughout the day. Just like with a warm compress, using a heating pad can help the boil start to drain. How do I get rid of a boil quickly? How to get rid of a boil. Soaking a clean washcloth or towel in hot water. Wringing most of the water out of cloth and squeezing it into a compress. Applying the warm compress to the boil for 10 to 15 minutes. Repeating this process 3 to 4 times daily, or until the boil has opened. Can apple cider vinegar get rid of boils? Apple cider vinegar will cleanse the boil and disinfect it. It also contains anti-inflammatory properties, which help relieve the redness and the pain caused by the boil. Take a teaspoon of apple cider vinegar and dab it over the boil. You can also dilute it with some water and then apply it on the boil. Is aloe vera good for boils? Benefits of aloe vera. According to research from 2019, aloe vera also has wound healing benefits due to its anti-inflammatory and antibacterial properties. Given its ability to protect and heal the skin, it's sometimes used to treat sunburns, trauma, and even boils. How do you stop a boil from growing? Here are some general guidelines. Keep the area clean and free of any irritants. Don't pick or attempt to pop the boil. Apply a warm compress to the boil several times a day. Don't reuse or share cloths used for compresses. How do you treat a large boil? For larger boils and carbuncles, treatment may include incision and drainage. Your doctor may drain a large boil or carbuncle by making an incision in it. Antibiotics. Sometimes your doctor may prescribe antibiotics to help heal severe or recurrent infections. What are you lacking when you get boils? Zinc is an important mineral for boosting immunity and is essential in the treatment of boils. Along with zinc, foods containing vitamin A, fish and dairy products, vitamin C, fruits and vegetables, and vitamin E, nuts and seeds, are helpful in strengthening the immune system. What draws out a boil? When a boil first appears, the pus-filled space inside the swollen bump, abscess, hasn't yet fully developed. In this phase, doctors usually recommend applying a warm, moist, antiseptic compress, a cloth pad held in place by a bandage, or a special ointment that pulls pus out of the boil. How do you treat a boil without a head? Apply a medicated ointment, topical antibiotic, and a bandage. Continue to wash the infected area 2 to 3 times a day and to use warm compresses until the wound heals. Do not pop the boil with a needle. This could make the infection worse. When should I see a doctor about a boil? A boil should burst and heal on its own, without the need to see a doctor. However, you should see a doctor if your boil lasts for more than 2 weeks without bursting. You have a boil and flu-like symptoms, such as a fever, tiredness or feeling generally unwell.
Take our lead. Let's help you make your mark.